Are suffering from back pain and that pain that radiates down your legs, then what is the reason? It is a very common finding that when your back pain, it travels through your hips or gluteal regions, through the back of your thigh to calf muscle, and you get this pain more while standing, walking, or sitting in a chair. When you lie down, the pain reduces. This symptom is known as sciatica. Normally this happens because of a disc problem in your lower spine known as the lumbar spine. Lumbar spine normally has 5 discs, but the lower 2 discs, namely the L4 L5 disc or L5 S1 disc, are more prone for a condition known as disc herniation. In simple line, it is also called as disc prolapse or sometimes slip disc. Sometimes there are fancy words written in your MRI report like sequestration or extruded disc fragment. They all point towards the same problem, that the disc has moved from its natural position and is now pressing the nerve. So normally whenever such situation arises, the patient typically gets a sharp shooting pain traveling down the leg through the posterior part or the back part of the thigh, and this is known as disc herniation related sciatica pain. Normally what happens, whenever there is a severe pain, patient finds difficulty in walking. And whenever there is difficulty in walking, it could be accompanied by numbness, tingling in the leg as well. So whenever you are faced with such a challenge, you should always see your doctor. And 97% of the cases can be treated with just medicines, exercises, physiotherapy and rest. It might be required for a few weeks, but slowly the patient gets better and ultimately can get back to normal life. However, only in 3% or less than 3% cases surgery is required. Surgery also has very specific indications like severe pain not getting relieved by conservative treatment, or if there are paralysis symptoms like weakness in the legs, or if there are symptoms related to passing of motion or urine, like if somebody is not able to pass urine or is not able to control urine. This situation is known as cauda equina syndrome and it might require surgery as well. Fourth condition is when there is severe numbness or tingling in the leg, when patient is not able to feel the leg. Lastly, the situation like whenever there is severe pain in the leg, patient is not able to get relieved by medicine, the pain is affecting daily activities, patient is not able to stand and walk. In such situations also surgery might be required. So if you are suffering from sciatica pain means the pain starting from lower spine region, the lumbar region, and traveling down the leg, then you should visit your doctor who will get your MRI done. And then based on what your MRI shows, how big is the disc prolapse, how much is the nerve getting pressed, he will advise you treatment. But 97% of the patients can be treated with just medicines, exercises, physiotherapy, and in less than 3% of the cases, we need surgery. Thank you.